Hey, so there's something I want to talk to you about. I did one of these home test type of things where it just tells you like about your background and your genes. And there was one result that was just kind of alarming, and I was hoping to talk to you about it.
Okay.
Uh, Basically, what it says is that I've got this. It said genetic predisposition to type 2 diabetes. And this was just like really shocking to me because I I never heard anything about anybody in my family having diabetes. So um, to begin with, I mean, first question is what's diabetes?
Well, there's two different kinds. Type 1 diabetes we usually see diagnosed more in juveniles. It's the immune system attacks the pancreas. The pancreas just doesn't make insulin, and so the sugar doesn't get where it needs to go in the cells, and it stays in your bloodstream, and there it creates all kinds of problems. Type 2 diabetes, that's what we see mostly in adulthood, and that's probably what your test is talking about. We see that more when people maybe they gain a lot of weight or they don't exercise, they go overboard with sugary foods, carbs, and their body just kind of gets used to the insulin they make and it stops responding. So the sugar can't get into the cells. It stays in the bloodstream. Then you start having problems with vision, kidney function. You can start having circulation problems in your extremities. So what's mostly what we're concerned with type 2 diabetes.
Okay, so for type 2 diabetes, if I what's this genetic predisposition? That means I'm going to get this?
It doesn't necessarily mean you're going to get it. It can increase the odds, but like a lot of conditions, environmental factors and lifestyle make a big difference. So
Okay.
diet, exercise.
So when we say like diet, so it means like sugar, because I don't eat a lot of sugar. I don't even like touch dessert.
Right, and there can be sugar in a lot of things that we don't think about, like pasta and breads and potatoes, potato chips, just things that you wouldn't think of. Soda as having sugar.
Which I can't
So,
have any of that?
well, you can. You just kind of need to moderate that, and you can check your blood sugar if you wanna go that route. You can get a little kit with a glucometer in it where you can check your blood sugar in the morning when you first get up and see kind of what your blood sugar's running. If it's staying around the 100 or a little below, a little above, that's kind of what you want to see. If you're getting up there 150 and above that, then you might want to talk to your doctor about possibly having further testing done, possibly an A1C, which we do when we want like a 3 month average of what your blood sugar's been running. So that can give us an idea of where your blood sugar has been, not just in one reading, but across the span of the 3 months.
Okay, so if I'm hearing you right, test does not mean I'm going to get diabetes. I can reduce my risk of getting diabetes if I just kind of watch the sugary foods, the higher carb foods. I don't need to be tested for anything right now, but down the road, it might be a good idea to get this A1C test. Is that pretty much it?
Usually, at about the age of 40 is when they start recommending that you get your A1C tested every 3 years. If you're not having any symptoms, then there's really no need to test before that.
Okay, okay, that's thanks. No, that is reassuring. All right, let's get dessert.